Chapter 7. Physiology and Injuries in Sports. Meaning of physiology. Physiology refers to the body's functioning. This is associated with study of functioning of cells, tissues and organs of body. Meaning of sports physiology. Sports physiology is the study of the long and short-term effects of training and body conditions of athletes. Indeed, it is the study of how exercise or sport activity alters the function and structure of our body. Physiological factors determining the components of physical fitness. Physiological factors for determining strength. 1. Muscle composition. 2. Size of the muscle. 3. Body weight. B. Physiological factors for determining speed. 1. Muscle composition. 2. Explosive strength. 3. Flexibility. C. Physiological factors for determining flexibility. 1. Muscle strength. 2. Joint structure. 3. Age and gender. D. Physiological factors determining endurance. Aerobic capacity. 1. Oxygen intake. E. Oxygen transport. E. Oxygen uptake. Energy reserves. B. Lactic acid tolerance. Effect of exercise on the cardiovascular system. 1. Increase in size of heart. 2. Decrease in resting heart rate. 3. Stroke volume increases at rest. 4. Increased blood flow. 5. Decrease in blood pressure. Effects of exercise on muscular system. 1. Size and shape of muscle changes. 2. Correct body posture. 3. Food storage increases. 4. Toned muscles. Effects of exercise on respiratory system. 1. Increase in tidal air capacity. 2. Decrease in rate of respiration. 3. Strong willpower. 4. Unused alveolus becomes active. Sports injuries are common in the field of games and sports. During practice, training or competition, any player can be injured. Classification of sports injuries. Direct injuries are caused due to impact of external forces. For example, a hockey player receiving a bruise from being struck on the face by a stick during a game. The other example is collision of two footballers. B. Indirect injuries typically involve the athlete himself by damaging the soft tissues such as the ligaments, tendons or muscles. Generally sprain and strain are the examples, e.g. sprinter gets hamstring strain while sprinting. C. Overuse. This type of injury is caused due to overuse or constant overuse of the body part, e.g. tennis elbow in cricket, javelin throw, etc. D. Soft tissue. These kinds of injuries are like sprain, strain, abrasion, laceration, etc. Common causes of sports injuries. 1. Improper warming up. 2. Fatigue. 3. Lack of safety equipment. 4. Lack of fitness. 5. Lack of sports facilities. Classification and types of injuries. Strain is also a muscle injury. A strain is caused by twisting or pulling a muscle or tendon. A sudden strain is caused by a recent injury, lifting heavy objects or rods in wrong way and overstressing the muscles. Sprain is a ligament injury. It may occur due to overstretching or tearing of ligaments. Many things can cause sprain. Falling, twisting, or getting hit can force a point out of its normal position. This can cause ligaments around the joints to tear. Generally, sprain occurs at wrist and ankle joints. Abrasion is a key injury, generally occurs due to friction with certain equipments or a fall over the area where bone is very close to skin. It may be caused by a fall on hard surface. As someone falls or slides on the ground, friction causes layers of the skin to rub off. Laceration, it is tearing in any tissue in the body, it may be external. A lacerated wound is often caused by a cut from a sharp object. Contusion is a muscle injury. A direct hit with or without any sports equipment can be the main cause of contusion. Contusion can also be due to minor accidents to the skin, such as falling, bumping into something, or being hit or kicked. Joint injuries and its types. A dislocation of lower jaw. B. Dislocation of shoulder joint. C. Dislocation of hip joint. D. Dislocation of wrist. Fracture. Fracture is a broken or cracked bone. It is caused accidentally by wrenching force. Fracture usually occurs due to a high impact on the bone. It can be caused by overuse. Types of fracture. 1. Simple fracture. 2. Compound fracture. 3. Complicated fracture. 4. Greenstick fracture. First aid. First aid is the most important and immediate care given to a victim of an accident, injury, sudden illness, or any other medical emergency. Aim and objectives of first aid. 1. To preserve life. 2. To promote recovery. 3. To procure early medical aid. Common first aid in sports injuries. 1. Price treatment. P. Protect the wound. R. Rest, no more movement. I. Ice to stop the bleeding. C. Compression to